Good morning. My name is Jane Lassiter, and I have the privilege of serving as the Dean of the College of Nursing. I'm delighted to welcome you to today's lecture and extend a special welcome to this year's Distinguished Alumni Achievement Award recipient, Dr. Amanda Orme. I also welcome her family and friends, and along with our students, our faculty, our alumni, and friends of the College of Nursing who are here today. We will begin our gathering this morning with an invocation that will be offered by her father, Lauren Duke.
Our dear Father in heaven, we're gathered today to honor people who do such good work for those who are in need. We're thankful, Father, that the university has such a good program that it prepares those students and graduates for the work that is so important for the health of the nation, for the health of the people that they come in contact with. We pray that thy Spirit will be with us today and bless those, and bless Amanda as she speaks, that she'll deliver a message that will inspire us all. We're thankful, Father, for our many blessings. We're thankful for our prophet. And we ask thee to look after those individuals who are suffering in our nation today, that they'll be comforted and be able to receive help as they need. And this we pray in the name of Jesus Christ. Amen.
Thank you for that beautiful prayer. We're excited to honor Dr. Amanda Orme. Again, she's been selected as the 2024 Alumni Achievement Award recipient for BYU College of Nursing. This award is given each year during homecoming to alumni who achieve significant professional accomplishments and have made meaningful contributions both to BYU and to society. Dr. Orme is a remarkable embodiment of the College of Nursing theme, our mission, which is to learn the healer's art and go forth to serve. Throughout her career, she has demonstrated excellence in this mission. She has served for more than 25 years at Primary Children's Hospital, most of that as a nurse practitioner, and has been working at the new Intermountain Primary Children's Hospital at the Miller's Family Campus in Lehigh since it opened. She has responsibilities in the emergency department, the hospital executive committee, and regional advanced practice. Clinically, she works as a nurse practitioner in the pediatric emergency department at a level, this hospital is a level 1 quaternary trauma center caring for all injured and ill children during shifts that include days, nights, weekends, and holidays. In her leadership role as an advanced practice director of the pediatric emergency medicine, she leads a team of 15 advanced practice practitioners in career development from novice to expert, and she oversees recruitment. At Intermountain Regional Medical Center, she is one of 44 advanced practice directors that serve 1,200 advanced practice practitioners in the Canyon regions throughout Utah and Idaho. Her work reflects the compassionate and skilled care of the healer's art that we strive to instill in our students. Dr. Orme's influence extends beyond her clinical work. She remains deeply connected to BYU, serving as a mentor to our graduate students, teaching as an adjunct faculty professor, and frequently returning as a guest lecturer. Her dedication ensures that the next generation of nurses is not only prepared professionally, but come on in, there's room. There's got some people looking for seats. We've got room. Also carries forward the commitment to compassion, healing, and service. Dr. Orme graduated from our bachelor's program in 1998 and from our master's program in 2005. She later earned a Doctor of Nursing Practice from Rush University and became a certified pediatric nurse practitioner in acute care. Her dedication to improving pediatric emergency medicine and her commitment to nurturing future nurses are just some of the reasons that that she was nominated by Associate Dean Beth Luthi and selected by our College of Nursing Alumni Board for this prestigious award. On behalf of the Alumni Association and the College of Nursing, it is our great honor to recognize you, Dr. Orme, for your outstanding achievements and your lasting influence on BYU, the nursing profession, and society. We look forward to celebrating with you throughout this homecoming week. She's going to everything, just so you know. She's so excited. And we are excited to hear your insights today. So please join me in welcoming her.
Thank you. I'm excited to be here. I'm excited to see everybody here and jump in and tell you a lot about my stories. So I couldn't be more excited to share my experiences. And I wanted to start with this scene at the beach because being a healthcare leader is like being drawn to the waves of the ocean. Sometimes it's calling me to come and relax. Sometimes it's raging and telling me to back up and get more prepared. So the goal today is that we'll enjoy our time together. I'm going to share some of my stories with you, and then there'll be moments where something might come up for you. And I'd like you to raise your hand, and we'll have some opportunities to share some thoughts. So let's jump in. Why? Why am I a nursing leader? Because over time, it's fun to create teams, and these teams become like family, and to share with other people a connection that is understood. The learning that continuously drives healthcare workers is the mission to help others, and that's why I continue doing it. The people I work with are amazing humans, and driving for excellence are the reasons why I do what I do. Faith is the belief and trust in a person, thing, or concept when there is no proof. The Savior promised, "If you will have faith in me, you shall have the power to do whatsoever thing is expedient in me." Our faith can lead us to do good works, help us overcome, and is not passive, but active and seen through our actions. In January, I was contemplating my annual goal, and I said to my leader that I wanted to work on my presentation skills. So when Dr. Lassiter called me and asked me if I would present today, it was already on my list of things to do this year. By the end of the year, will have 10 presentations, which is more than I've ever done professionally. And I'm excited to be here today. It was unexpected, and I feel like it's a gift that has come and been blessed and given to me. So let's celebrate and share and connect together. Maybe what I share will help you to see joy in the experiences that you're having. And then, like I said, let's have some interactions. So here are some objectives. First, live your healthiest life because you matter. Second, do hard things well and create joy and connections. Analyze where you are and where you want to be. My journey is not perfect, and I'll share some of those things with you. We are at different points in life. Some of us are in the 6th grade. Some of us are ankle deep, knee deep, waist deep, or all in. Where are we going? And where and what are we exploring? So I would like us to take a path to more joy. How can we be all in on this? So this is me actually as a toddler in Maryland, at my family home. But I'm the second child, an eldest daughter of 8 kids, or girl. So leadership started when I was very young, and it started with babysitting. And I have a birthday in December, so this makes me the oldest in my school group. But it also makes me the youngest in my church group, and with opportunities to watch older people lead. But I have 4 younger sisters, 2 younger brothers, and 1 who's older than me. And some have expressed watching me grow and wanting to follow in my footsteps, although I'll just remind you, none of them are nurses. So, my mother was a vice principal at a junior high, so I didn't get away with much when I was a kid. And my best friends in high school were really adventurous. We had a motto, no missed opportunities. So, when I started college, I learned from this motto and I took it with me. At the time, I liked the idea that we are not ordinary, but we're choice, and we're led to experiences that matter, either to ourselves or to others. Faith, so crucial decisions. Faith, spirituality, and a belief in Jesus Christ were a foundation that led me to BYU. I brought with me my internal grit, endurance, and over time developed a growth mindset. From high school girls soccer, where my best friend introduced me, and I decided to stay with it, I'd made the team and learned that I could continuously improve compared to myself. I'd never played before when I went out. At one point, my friend couldn't play anymore because of academic performance, and so she had asked me to stop playing, and this was a hard decision, maybe one of my first social crucial conversations that I had. These conversations are hard, and but having this conversation at that time and sticking to my goals that I had been participating in, I stayed with it, even though it had high stakes, I had high emotions, and we had opposing opinions. But these types of conversations make up 20 or 30% of our conversations. I was called into nursing. This happened one day. I just decided I was going to be a nurse. I don't know the exact moment, but it was a quick decision and it felt right. Over time, I learned that through the song, Lord, I Would Follow Thee by Susan Evans McLeod and Kay Newell Daly, that they encourage people to become more like the Savior by learning to strengthen and lift others. The 3rd verse says, I would be my brother's keeper, I would learn the healer's art. To the wounded and the weary, I would show a gentle heart. This encouragement to learn, strengthen, and lift others is a strength I learned from my relatives initially. And then again at the BYU College of Nursing, like it's been said, where the theme is, I will learn the healer's art. At a young age, I was caring for others by holding, rocking, and feeding, and so naturally my role as a nurse felt right. Leadership and the role of influencing are skills I've been working to develop. So, let's pause for a moment. I'm going to have you just think through, raise your hand, think of a time in your life when you met a challenge. What were you challenged with? Are you thinking about it? And then I'm going to invite Ava up to help me because I'd like to hear some thoughts from you. So if you could, just think of a challenge as I am telling you about a challenge that I was met with when I came to freshman orientation. So Ava, come on up. And then when your challenge pops in your mind, please raise your hand. So my challenge came to me as I was weeding the flower bed. Marlena, she was an only child who lived across the street from me. And she and her mother were on their way to freshman orientation. As I was weeding, she drove by and they asked me if I wanted to come. So I ran in the house to change my clothes. I was told I was going to have to change. And I was wearing shorts. So it was the end of the summer. I was rummaging through trying to find some pants that fit me so I could come to BYU campus. And next thing I knew, I was standing on the plaza right out in front of the Kimball Tower. There was a big sign that said, "Nursing orientation this way." And that's where I came. What I learned there was that the college was very hard to get into. And what they did there was help other people fix things, work hard, and persist through moments of heartache. I was also told I probably wouldn't get to go to that college, that most people in the room who wanted to be nurses would need a backup plan. And I remember thinking that this didn't deter me, but this was the challenge, that I was going to make it. I knew how hard work, and I wanted the uniform, which was but most of all, I wanted that feeling of fixing something and helping others and relieving suffering. So, what challenges are coming up for you today? Who'd be willing to just break the ice and raise your hand?
Some of the challenges for me are I have neurodiverse children, and learning how to interact with how their brains function and work and meet their needs while helping them not get stuck in what their challenges are. That's tricksy for me.
Thank you so much. That is a passion of mine, and so important. So next we're going to turn to awareness of events and leadership. Did anybody here watch the Olympics this summer? I bet we watch it differently. Some of us are binge watchers, some of us maybe are dippers, and some of us intentionally watch only one specific event, and maybe there are even some of us who didn't know that this summer was the Olympics. Awareness is knowledge or a persistence of a situation or a fact, and events are the things that happen. In leadership, awareness of events is useful to see your behaviors and recognize areas of need and growth. Some top areas of leading are behaviors like humility, integrity, emotional intelligence, collaboration, change management, problem-solving, decision-making, and conflict resolution. Bernadette Melnick is a nursing leader in Ohio. Like me, she had a wonderful husband and 3 kids. She's also a scholar and a leader and has innovative ideas that are improvements. And, she focuses on these improvements, puts together proposals, and before the Fold Institute was developed, which is an evidence-based practice institute, she put the proposal through 7 times before it was approved. And she said, although cardiovascular disease is still technically the leading cause of death in the U.S., behaviors are truly the #1 killer due to physical inactivity, unhealthy eating, smoking, drug overdoses, and non-adherence to medication treatment regimens. So on that note, we can do better. And we must take care of our teams. And it starts with us, and it starts with our own health and well-being. So, this is my challenge, and it's been transformational for me this year. I've thought a lot about my boundaries and to care deeply and prepare myself for my own health and to continue to serve as today is my Olympic event. And I've been practicing presenting, and I've been, working on the things that it takes to be one of, a focused, trained Olympic athlete. Like a sleeping plan, like an eating plan. Those are, places that I could improve. And considering my shifts, working nights and weekends, I have to find a way to manage that and still stay healthy. But no missed opportunities, so here we go. When you look at my history and you think about the things that I have been able to experience, there are things that have happened that I wouldn't have done without these opportunities. like applying to nursing school for the second time. The first time, I didn't get in. I had to regroup, retake classes, and then try again. Like applying to nursing school, graduate school, for maybe the wrong reasons, maybe not, but I experienced infertility, and this has helped me grow and develop my career. But I did go on to have 3 wonderful kids. And going to graduate school, for maybe not the best reasons, it took me 2 trips to finish my master's degree. And during the first trip, I had my first child, so that was a success for me. And then my specialty profession of choice, and then returning a 3rd time to finish the doctorate in nursing practice. These building blocks make up me, and they are my journey. And the idea of faith is that we can learn and grow from our failures. Faith doesn't guarantee success, and failure doesn't prevent it. So having a growth mindset, persistence, and seeking better understanding will help us. So we have many leaders in this room, and I'm just going to back up a bit. Oh, you might have to help me here to back up, but I think I can get it. Here, so let's see. Go back here. Okay, so you might not be thinking of yourself as a leader, but this is the time to kind of break free and stretch yourself. So what would be the most useful thing to you in your journey to leadership? What would you say? Go ahead, please raise your hand. Ava's gonna bring the microphone around. I just wanna hear who's brave today? Who wants to share what is the most useful thing to you that you think you might find on your journey to leadership? Support. Absolutely. That makes a complete sense. A circle of support is so important. And I found this support through each of my roles. So, jumping in to bedside nursing I was working at the BYU candy counter, and I was doing prerequisites going to nursing school, and I thought, I need to get some experience in healthcare. So I took the 6-week CNA course, and that led to 2.5 years working in a nursing home, where I had a lot of really great experiences taking care of adults who were accomplished, who had then lost something. They lost skills, memory, and were experiencing loneliness. And I thought one day, after working for a few years, I might have more friends in heaven than I have here and on earth. And that's not true, but that's where I was. And I remember thinking, while it wasn't true, I had made significant connections to the people that I was taking care of. And I'll never forget some of those people. The first person that didn't have a pulse. The lady I fed the cottage cheese to in the last week of her life, and then had to get it off her dry tongue just so it wasn't the last thing for her. Or just, cleaning up different things, like we would call them large stool babies, or vomiting ensure, things like that. Taking care of the ileostomy the person with the ileostomy named Winnie the Pooh. That was one thing that I've never forgotten. She had a very meticulous bedtime routine, and I remember thinking that the things that I'd learned from my mother also helped me take care of her, just to stay with it and stay in an area of service. So I reflect on that just as I've grown through my nursing career. And I'm going to share with you some other experiences that I've had where I have learned from situations that I experienced at the hospital. So these are 4 memorable saves for me where I had lessons learned. The first one was a patient who didn't have any blood pressure. We'd been taking care of a patient who had Kawasaki disease, which is a type of vasculitis. He was waiting for a heart transplant. And we'd been taking care of him for months, but the day that I took care of him, he had no blood pressure. Although he still had some blood pressure, we just couldn't measure it with the automatic cuff. And I remember making phone calls, asking for help, and the cardiologist telling me, well, do you think I have to come to the hospital? And I said, well, I don't know, but somebody does. I need some help. And arrangements were made, and then we were taking the patient down to the ICU. And as the elevator doors closed, the cardiologist jumped into the elevator. And what I learned that day was that I could just say yes. Like, I needed help, and when he asked me that, or she asked me that question, I should just say, yes, come to the hospital. And so just to stand up for what I was asking for. But Kawasaki, you recognize it after 5 days of fevers over 101, and they have rashes, swollen lymph nodes, red eyes, and they're very irritable. And the problem with it is you get coronary artery aneurysms. The next one is septic shock. Taking care of people with septic shock can be something that you need to look for. It can elude us if we're not looking for it. But this particular day, this patient had a beta hemolytic strep septic shock, and she'd been in the ICU for weeks. And so she was transferred out to the medical unit, and 1 hour before my shift change, I had been working for 11 hours, and I was sort of looking forward to going home. But there were a lot of things to do. There were dressings to change and medicines to be given, and about 10 or 15 minutes into it, I realized that this patient needed more support. She wasn't ready to be outside the ICU. And I was on the phone with the ICU at her bedside. But her mother was out in the hallway, yelling for help, 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 up and down the hallway. And what I learned that day is that even though I might be doing the right thing, at the bedside, on the phone with the ICU, and moments later back down there getting her the support that she needed, communicating that with parents would be a skill that I needed to work on. So for this next slide, if you're a little squeamish, especially like in the creepy crawlies or slimy things, then maybe you don't want to look. So I'll just give you a little warning. But I came on one day to leech therapy, and I was like, no way, I can't do this. Over and over in nursing, sometimes there are things that we think we can't do. But this patient had had a lawnmower accident and was post-op and had the upper extremity splinted. And we were putting leeches on the fingertips to help increase the perfusion all the way to the end to help improve healing. And Dave was the nurse handing off to me, and I remember him taking me through the steps of how I was going to have to do this every single hour. And I was like, no way, I quit, I'm leaving. I was crying, I'm emotional, the tears just come forward, and I was like, no way. But what I learned that day is that I can do anything with gloves on. This one was a situation of croup. Croup causes swelling at the larynx and trachea, and it can cause partial airway obstruction. They bark like a barky seal cough, and they have stridor, and stridor sounds like you can't get air in, like that. And then they have fever, and it can be threatening to life. And so I was working in the ICU, taking care of a patient we'd extubated, and after a few hours, we were making arrangements to take them upstairs to the medical unit. And we packed up all this stuff, unplugged the bed, and we were kind of rolling off down the hallway. But we were probably 5 feet from the bed space that we were in. And at the time, our ICU was like a big gym. You could see like all the beds and all the patients. And this patient sat up and started making this stridulous sound, like, and I was like, okay, no, we're not going upstairs. So we backed back up, and moments later, we were re-intubating this patient. And the lesson I learned that day was to lean on my experience and to speak up for my assessment skills. And I should have known I would be emotional, but it does bring up a lot of emotion for me. So these experiences were hard at times. And there was a point in my career where I thought a clinic job would make my life easier. And so that's where we're going next. I learned working in the clinic, although I never left the ER. I always worked shifts in the ER on the weekends, but I worked in the clinic for a period of time. And what I learned is that the patients and the parents report similar problems in the hospitals and clinics, and I had to dig into the evidence and own these conversations and work on shared decision making. And taking better care and coordinating care with patients and kids. So a few of my patient experiences in the clinics are the day that I took care of a kid, a teenager with sudden onset pneumomediastinum sitting in their classroom at school. And this has come up several times, so not an isolated incident. But as I was taking the history, the only thing I could think was like, this patient has a pneumothorax, which is a totally collapsed lung. And then during the exam, I felt that Rice Krispie feeling that you feel in this, like in the when the air leaks to the subcutaneous tissue, and it kind of like pops and crackles like Rice Krispies sound. When I told them I needed them to go to the hospital for a chest X-ray, the mom had this vasovagal reaction and passed out. And I was like, oh no, how are they going to get there? So then we arranged for ambulance transfer for both of them. So that night, well, not that night, but one of the night clinics, we had these 5-minute strep check appointments. And I had a patient check in who'd had a swollen red knee for 3 months. And they wanted a strep test because they had looked online and noticed that if you treat strep with antibiotics, maybe your red knee would also get better. So they were looking for help. And I had talked to the rheumatologist earlier that week, and I just needed this family to give me 5 or 10 more minutes so I could call the rheumatologist and get them the treatment that they really needed, the labs that they needed, and the follow-up that they needed. Juvenile idiopathic arthritis is the most common rheumatic disease of childhood, and 3.8 to 400 out of 100,000 kids are affected. So that was the condition that this patient had. A few months after I'd seen them in clinic that night, they called me, and the MA said, there's a phone call for Dr. Orme. And nobody calls me Dr. Orme. I was like, oh, okay. And she's like, they want to know what you think. The specialist says they need, these tests, an endoscopy, a screening endoscopy, and they want to know if you would recommend it too. So I thought we had built this connection of trust. This patient was telling me about symptoms of fatigue, just not feeling good, and I was starting to have a little bit of panic during the visit because my schedule was starting to back up. But as I did the physical exam, I felt the goiter, the lump in the neck. This can cause patients fullness and tightness and difficulty swallowing or coughing, and it can even change your voice. And at that moment, I knew that I needed to get labs. This patient had a hypothyroid disease. The one that, when I think of fever, I think of most patients I see on most days, mingled with a little bit of other things. But one patient with chronic developmental health conditions had fever, and there weren't really any other sources like respiratory symptoms, cough or runny nose. And talking with the mom, I wanted to check the urine because patients frequently hide infections in their urine. And we were talking through it, and I was explaining, the catheter, and it's kind of like a spaghetti noodle, and we're going to get a small sample. And she's like, do you really have to do that? And in that moment, I thought, well, if we want to know what the problem is, then we should do it. And this patient had a urinary tract infection. Considering her age and the infection, the guideline says to get a renal ultrasound. And she had a duplicating renal collecting system. And from that time forward, every time I was in the clinic, when they came for appointments, even though they weren't seeing me, they might be seeing the pediatrician, she would put her head out the door and wave and say hi. So that's why I do what I do. Kind of think about the reasons why you do what you do. And let's pause for a moment, and raise your hand, and Ava will bring you the microphone. I'm just looking for like one summary statement from one brave leader in this room. Why do you do what you do? And or share a time when your healthcare provider saved your day.
So I worked as a CNA at a nursing home for a time, and I helped one of the residents get to bed, and she said to me, "Thank you for rescuing me," and it was like the sweetest thing ever. And the day had kind of been a hard day, and it was just made it all worthwhile. So that's why I do what I do.
Thank you so much for sharing that. We have this circle in nursing where we kind of move around and try different things. You orient people to do the job that you do, and then you might go off and try something else. And my experience over time is that people I oriented to one of my first jobs, then they had moved on to somewhere else. I came around like a bullseye, and then they oriented me. But 25, 26 years later, Becky is the person I oriented on a really hard day when a patient had really bad pain. We couldn't get the patient-controlled analgesia pump to work, and I was stressed. I said things I shouldn't have said. And she and I work as leaders in the RTU and the ER at Primary Children's in Salt Lake, and she'll remind me occasionally about how far I've come and the things I've learned. And anyway, this circle is really important to me. Even when we don't get it right and we make mistakes, that we can move forward. I had a lot of crucial conversations in going to graduate school and attending graduate school. And, but by completing my education and getting my DNP, I really feel that my writing skills and my speaking skills have improved, and I continue to improve and work on these things. One approach was the way that I give bad news, because bad news does come up in medicine. But using like a systematic approach of delivering bad news has really helped me just prepare people before they get bad news that they're going to want to have support people around them. And just asking and being mindful of who's in the room and who needs to be in the room. But then also warning people that they're going to get bad news, and then leaving a space for them to kind of soak that in and then ask more questions. So I'm going to skip this story because it'll make me cry, and then that'll, make it harder. But one day I had this real connection with a lady that I felt like could be my best friend. And although it was time for me to go to lunch, and I usually leave bad news for the attending physician to give, I thought, I'm trained to give bad news. And this lady, I didn't want to go to lunch because I knew the results and she needed to know the results as well. But I felt like in that situation it went well. And most importantly, I was able to share with her the results of the CT scan that we had decided together to get, and her child had a brain tumor. So remember a statement from Samuel Johnson: "To do nothing is in everyone's power," but George Herbert got it better, and he said, "Good words are worth much and cost little." So these conversations need to finish clearly, determining who does what by when, make deliverables really crystal clear, and then set a follow-up plan. Record the commitments and then follow up, and finally hold people accountable. And that's the part in leadership is holding people accountable while building relationships. So advanced practice nursing and just changing career path into advanced practice nursing. Just to share that this is a nurse with postgraduate education and training in nursing. And nurses practice at this level, they can work in specialist or generalist capacities and can diagnose and treat disease. Sometimes my friends ask me why I didn't finish medical school and be a doctor, and I can tell you that a doctor takes care of really complex patients' diagnoses, and they do specialty care and lots of treatments. And I never intended to be a doctor because I'm a nurse. I studied as intended, and I gained my skills through my education in nursing. I did not go to medical school, so if I was going to be a doctor, I'd have to start all over just like anybody else who wanted to be one. So, at Intermountain Health, we have an advanced practice statement. And this statement talks about our dedication to being medical providers who treat acute and chronic conditions across the entire lifespan and deliver quality, compassionate, and culturally sensitive care. We uphold the highest standards of safety, professionalism, and ethical conduct. And as members of an interdisciplinary team, we are committed to patient-centered care and advocacy through thoughtful collaboration and respect for others in the community we serve. And we believe in and support Intermountain's health's mission to help our patients live the healthiest lives possible. So I wanted to share with you a statement from the astronaut John Glenn, because he said, the more fulfilled we are when we're involved in something, the more fulfilled, how does it go? We are more fulfilled when we are involved in something bigger than ourselves. And that has certainly been true for me. The Church of Jesus Christ of Latter-day Saints and nursing. The mission of nursing and the mission of the Church of Jesus Christ of Latter-day Saints have roles in caring and service for other people. The church emphasizes leadership principles like service, humility, and stewardship, which apply to nursing leadership. Okay, time for another leader to step forward and share with us some service or care for someone in need. Do we have another brave leader who wants to share? I know there are several of you who serve in leadership positions, and so I'd love to hear maybe one of your experiences that you have.
Yeah, so I had the opportunity to do a couple of clinical shifts at a nursing home. And I had to remember that day was just rough. Like, I had gotten peed all over, and then I had to clean up somebody else who had like a full blot, and I was just done with my day. Like, it was about to be the end of my shift, and I was just like, can I just go home and rest? And so we had to transfer one of our patients from wheelchair to a chair just so that she could watch some television. And when I did it, she just grabbed my face, and I was in complete shock. And I was like, uh-oh, what did I do? But she grabbed my face, and she said, thank you so much. You are the best nurse that's ever taken care of me. And so, out of all of the things that could have happened that day, that was one of the most touching moments, because I was like, this is the reason why I'm doing this.
Such a strong foundation, that service, at those moments in life. And I know that throughout my career, my leadership has been built on those moments that are so meaningful and special. In the book, Crucial Influence, it explains why people do what they do and how you can influence change. And when was the last time somebody's behavior stood between you and changes that needed to be made? And how would that look? Leadership is influence, and there are 3 keys. I wish we could answer this question today. We'll skip. I know. So the 3 keys: focus, and then vital signs and behaviors, and the third is engaging. Here are the vital signs and behaviors. You can see the support around her. And then engaging the 6 sources of influence. So we have different things that influence us to do what we do. It can be areas of personal, social, or structural areas, but we're also influenced by our ability or by our motivation. So in this example of leaders helping people love what they hate, to do this we can use different tactics. And you can think about the tactics as aiming at one of these areas, either personal motivation or personal ability, structural or social motivation or ability. Okay, this is me, and what is a true emergency? This truly became an emergency when my gear changed, and wearing glasses, I had to tie stitches during the COVID pandemic. This was really challenging, and we worked hard as a team to meet these behaviors that would protect patients and help us continue giving this care. Sometimes it keeps me up at night thinking about what I say and how I interact with people in the emergency department. The most important thing I do is that I don't want them to leave thinking that they can't come back. It's very important for me to give my opinion and to share information with them that is useful to them and help them understand what's going on with them, but also know that if things progress, that they can come back. And so I'll often say to my families, because people are worried about, did they come to the emergency department for the right reason at the right time? If you're there and we're there together, you're there for the right reason at the right time. I've seen people come and wait too long. But I'll often tell them, I'm here always. I love taking care of kids, and the lights are on bright all night. At Intermountain, we aim to provide extraordinary and consistent care no matter where, when, or how someone interacts with us. No matter where we are located, we act as one coordinated team. So if you're a nursing leader here at BYU, if you would stand up. There are more. I see your faces, but they don't want to. But we're nurses, so we have to work on our skills. So stay standing up. If there's someone that is willing to help us with an example of how BYU and the Church of Jesus Christ work together as one coordinated team to give students extraordinary experiences.
I looked around and I'm like, how come no one else is standing except for our dean? So I think that one of the things that we really have understood about BYU is this connection and ability to talk about spiritual things while we're talking about academic things. And that's a very unique situation at any university, and it's very unique here at BYU. And certainly, I think sometimes I don't want to call it a burden, but I think for faculty, we think a lot about what we're going to say to you as students and the experiences that we want you to have while you're here, as we help you try to develop your testimonies and also develop your ability to be a nurse. And I think my students know that this is going on my 5th year at BYU. I've spent the majority of my career working in hospitals. And the reason that I came here is because I had a very spiritual experience teaching one little class at BYU many years ago, and my Heavenly Father told me in the circumstances that I should be here full-time teaching. and that meant I needed to go back to school to get a PhD. It meant that I needed to change my career and learn how to be an educator. But the reason I'm here is because I want to work with all of you as students and give you the kinds of experiences that I've had in my career and help you be the very best nurse you possibly can as you learn the healer's art.
Thank you so much. That really sums up what I love about BYU, a beautiful campus and natural feelings of hope, peace, and reverence. So if you come do some clinicals with me, we'll talk a lot about the systematic process, the process of how we take care and listen to patients and put that information through the process to come out with the diagnosis. And so I was going to share with you some of my failures in this area, but I think we'll skip those. And we'll talk about what help looks like. Help's different depending on your lens. And I might help you by doing painful procedures, and sometimes people will ask me to bake bread, and I say, I'd rather get spinal fluid out of babies. But I'm pretty good at baking bread too. So one day I heard some screaming down the back hall, and I ran down the back hall, and I found a well child with a 4x4 taped to his forehead. And I washed my hands, I put on some gloves like I always do when kids are well and when they're not. And I looked under the gauze, and there was just this little tiny scratch, and I thought, oh, this is gonna be okay. This is gonna be okay. But then just reassuring people, reassuring this parent that it was gonna be okay, and then still teaching her how to take care of the wound that was smaller on my scale. So one thing that I'm proud of was aligning my certification with what I do. And this was really became important to me in about 2017 when I was at a national conference learning. And I met a lady. I'd been experiencing infertility throughout my marriage, and she was really entertaining, and I kind of followed her around the conference and was listening to her. She had 2 kids like I did at the time. Her kids were prosecuting attorneys, and she was telling me stories about how I was working outside my scope of practice and how important it is to line up our education with our practice and what we do. And that was really pivotal for me in making that change. So what is leadership? It's intentional, and it's intentional influence. The lady who has influenced me the most this year is a parent of one of the kids that we see frequently. He has epilepsy and comes to our ER with short seizures or long seizures. And what she taught me this year during, they had arrived, he was having a seizure. We were kind of going through our process like we do. And I grabbed a paper towel kind of at the end of the primary survey. This is, the primary survey is like where you assess like breathing, is there a pulse, is there breathing, and then you look at the pupils and you assess their mentation. And I'd grabbed a paper towel to write down notes that EMS was going to tell me, but specifically I was listening to like what medicines they'd given so that I could like take it to the next step. And in the middle of that, she yelled out to the entire room, like, "You kill my child, you kill my child." And because I had said to the bedside nurse, "Go get some Ativan. This child's having a seizure." And she said, why you write on paper towel? Because English is her second language. And I said, well, I want to take notes that I can remember, so I'm writing on this paper towel. And she said, use the computer. Open the computer. And so I was all like twisted up about it. I was like, but I stopped and listened and opened the computer, and what popped up was he's allergic to Ativan. And so that's what she was telling me. And so just that listening and using our resources wisely and not skipping over steps was a really good learning point for me this year. Leadership is a human process of cooperative achievement. And so we can do this. Jesus says leadership is, or what would Jesus say leadership is? Maybe the role of leaders is not to serve themselves, but to serve those that they lead. So if you know any leadership styles, if you would raise your hand and share with me, maybe somebody that we haven't heard from yet wants to share a leadership style. Okay, sir. Oh, thank you. Thank you. I definitely don't want to skip over servant leadership. So we'll go to that. Considering service perspective and the humility is crucial in nursing, and leadership, like any other profession in nursing, is a mission to help other people live healthy and happy lives. And the example of Jesus washing the feet of the disciples and empowering others to emphasize from a learning point that where other people are at, and how he taught his disciples to learn and grow from where they were. It's very meaningful. And there are traits also that go along with leadership. These traits are things like candor and being candid. So being candid, if somebody told me that, your speech was really boring, then I'd say, I don't want to be friends anymore. We could both be candid. But another trait is empathy. You can have active empathy and cognitive empathy. But using styles and traits in leadership, we can function on teams if we understand these circles and rings. So there are circles of control, where what we control is where we do our best work. And the skills we can build to influence is the next ring around that. But getting caught in the circle that we have no control over is somewhere we can spend a lot of time and have little impact. The rings are in reference to the team that you lead. If your team is complaining to you, you comfort them. You comfort into your team. But if you need to vent, then you've got to be on someone else's team. You vent up to your leaders and comfort into your team. So we cannot solve our own problems in the same thinking that we use to create them. And relationship building is vital. It's the most important. Knowing who you are. I'm INTJ in the Myers-Briggs survey. INTJ is like one of the 16 personality characteristics. Some of you who know me, you might think of me as like an architect, a mastermind, or the strategist. That's my favorite one. But it really did come up that way. I'm an introvert. I intuitive, a thinker, and judgmental. So there's always room for learning more. I was telling Dean Lassiter this morning about TILT. TILT has 4 areas. It's how we show up in teams. There's visionary, there's connectors, there's structural people, and then there's clarity. A lot of us in healthcare are clarity. We're like digging out data and becoming more clear in who we are. And we kind of overlap in those 4 things and 4 areas. If you're really strong in one area, then you look for people who are strong in other areas, and you can build a really strong team together. So finding influence, no matter your area, if behavior isn't changing, then you aren't leading. And I was going to share with you on my anniversary walk this year, we were up at Snowbird, and from far away down the path, my husband could see this deer sitting under the trees. But I couldn't see it initially. I mean, I could see it when we got closer, but he sees things I don't. And when I learn to appreciate his strengths and my need for enlightenment, then I learn new things. So just in wrapping up today, I want to share with you what matters most to me. I work clinical shifts and office work, both. At home, I have mental, social, and spiritual work to do. And my role is vastly different depending on the tasks that are on my schedule for the day. From ER visits to meetings and coordinating how we work together, learn together. This is my jam, and I stay in tune with my 5 areas of health: my physical, mental, emotional, spiritual, and social health. So make your sandwich. You matter. Thank you.
Dr. Orme, thank you so much. What a remarkable day we've had. Thank you so much for coming and sharing your wisdom and your insights with us. It was remarkable. This is a little gift for us, from us, for you. It is, our Ava found out the name of it. She's amazing. It's called The Robe Messiah by DJ Bodden. And that is a little gift that we hope will help you remember the inspiration that you are to people and how you exemplify the healer's art. So thanks for coming and being with us.